I'm delighted and proud to launch and lead this conference dedicated to the French health innovations to help under-medicalized areas. So we are together for 1 hour and a half, and we've got 3 panelists here and 3 panelists remote. Okay, so it will be a very interesting game to play, how to mix this kind of approach. So, but it will be a success. Okay, I would like to thank a lot first French Healthcare Association, a very dynamic association, and help in particular Elisabeth Arnaud and Joanna Lerfeld that are leading this association very successfully. So I will make a quick introduction about the context of our group to help under-medicalized areas. And after we will have 7 presentations for very, very innovative solutions we have on services we've got in France. And we are, as you know, a good healthcare and social protection system in France, but we have also some problems for under-medicalized areas. And for instance, for each solution we are presenting here today is also in France. But we will be very proud to help other countries to get better situations. So. By my side, CAISA I'm the president of CAISA. We help firms, organizations, France and abroad, and to implement services for e-health, but not only e-health, to help for under-medicalized areas, and to make the link with the solutions, services, and how to implement financial response or answers also. Okay, so today I have the pleasure to have on our side different, very innovative solutions from France and services from France. I discovered recently a firm called Noradom. Noradom, and Professor Gilles Kemoun is the president and founder of Noradom. Is for telerehabilitation. We will see a quick video of that firm. After Dr. Mehdi from France is in remote situation. Mehdi, it's a really wonderful innovation from France called EcoPen, and he will present us for 3 minutes. 3 minutes. And of course, in France, we've got a lot of startup very successfully, but also champions. We've got our champions called, for instance, Orange, and Innovacom is the e-health activity of Orange all over the world. So Simon Chassin with us today. After H4d, in my opinion, H4d, H4d in English, it's the best solution in France for medical cabins for services, clinical services, and maybe in Europe. H4d, Franck Bonino, the founder, is with us. After Telem 360, 360, okay, a good expertise all over the world for how to implement, because it's very important to know how to implement e-services. Aquantik, it's also with Alain Abra, a wonderful solution, very innovative. It's a licorne for France, I think, it's a future licorne for France. And then we will finish with Professor Antoine Tenière. It's a clear demonstration how in France we are promoting, we are helping our licornes on startup and firms that want to make excellence all over the world from healthcare, and particularly for e-health. And so Professor Tenière is with us too. So first, Noradom for 2 minutes. His name is Roland. Roland is in the rehabilitation process. And as you can see, he's in front of a screen at home, making very easy exercises. And he can have a short discussion with a physician after this exercise. So it was a very short description. And maybe you can present now EcoPen.
Definitely, yeah. You can hear me right well?
That's wonderful. We see you.
Okay, excellent. So I request the control and can move forward to the presentation. I'm very thrilled to present you EcoPen Factory. Thank you, Franck, for this introduction. We're developing here, let me pass the other. Wow, I pass it too quickly. Yes. This way, it's very sensitive. So we're doing basically ultrasound imaging, and our goal is to make it accessible all around the world. And we're developing a device, a connected device that you can see here, connected to any kind of smartphone, and dedicated to orientation diagnosis. I will say a few words in a bit. Let's have a glance at the worldwide problem. 2/3 of the worldwide population do not have access to medical imaging. And here, the potential targets as healthcare professional is about 70 million of healthcare professionals that can be users of this kind of solution. What we're addressing here, more specifically, is to answer two very basic questions that any kind of medical practitioner answers himself when he meets a patient. The two questions are, is the condition serious or not? Which organ are damaged? This is really the two fundamentals wherever we are, whatever medicine, whatever patient, whatever MD, these are the two very basic questions. And this device enables you to see inside the body and to answer those very basic questions. You can see here the device connected wireless to any kind of smartphone. And if there is a technical audience, let's say a medical audience, we have 3 probes into one, which enables us to get an image from the bottom to the top at any depth. So it's really very convenient. We augment the solution with AI-based services to enable a better image quality, to enable a better gesture for the medical doctor, and also diagnosis assistance. Where we are now is we're expecting a launch really soon. We finished the industrialization, and we'll be happy to take the world by storm, because in this after COVID and hopefully after COVID situation, there are really a strong trend to make ultrasound handheld devices available anywhere in the world, and we are the one targeting this ambition.
Thank you, Mehdi. It was very clear. Stay with us, please. We will have some questions, of course. Okay. So, Simon, right now? Simon Chassin from Orange Innovacom, large group, champion of France.
Hello, everyone. I'm Simon Chassin. I'm representing Innovacom. We are the e-health branch of the group. For people who don't know Orange, this is a telecommunication operator operating in 26 countries and globally over the world with Orange Business Services. A few figures: this is 42 billion of revenue worldwide, 260 million customers around the world, and 142,000 employees supporting this activity every day. And on our side at Innovacom, so like I said, we are the e-health branch, so we are leading the B2B offering of the group, and we are actually developing some software solution that take care of data in general. This is what we call interoperability. This is a strange word that make communication between systems that doesn't speak the same language. And actually, we develop some solution that should help healthcare provider to save more time for better care. Let's start the. Okay. So to address under-medicalized areas, I think first thing is to implement some foundation to make actually a communication between the local facility, the underserved area, with the expert facility, the support facility. For that, we need to implement some connectivity. So the first thing is the network to make a communication possible between the two facilities. So it needs internet connection, but also 4G, 5G, and what we call LAN-to-LAN connectivity that allow the local facility to access the information. Like you know, maybe IT infrastructure are very costly. Pricing are going up, and we can see that the cloud solution can really be an enabler to facilitate fast implementation. And as you also know, medical information are quite valuable. There is a lot of threats around this information, so we really need to make sure that there is the right cybersecurity around all that connectivity, and this is everything that Orange can provide globally in the country we are actually operating, but also worldwide. Once the connectivity is okay.
The remote device is not really connected right now.
Okay. So this was the Orange group expertise and knowledge to make sure that we can connect local facility. Now we also need to take care and to make sure that there is a continuity of information between the local facility and the facility that will support in terms of medical expertise. We need to make sure that the information is shared among these two facilities before the patient care, also during, of course, but also after, making sure that the healthcare professional, the healthcare experts will access all the medical file. There is also a huge need in terms of information sharing with the global ecosystem, which include the doctor in the city, payers, third-party health providers, the health record, the national health record when it does exist in the country. All this continuity of information topics needs some requirements, and I think it's a lot has to be done at a national level. We need a real policy for that. We need a patient ID, so we can make sure that we are talking about the right patient. We need some standards, and it has a huge role to play around that. And the last thing I think that is very interesting to mention is to use the mobile to make this happen, because as you may know, in some areas they've made a huge jump between nothing and mobile. This is not maybe the case in Europe, but in some countries there was nothing, and now they are all using mobile thanks to the network again. And I think this is really important to keep that in mind, to make this to achieve this target of addressing the underserved medical areas. And we can actually talk about two cases. Here at Novacom, we are developing a mobile application that allows the patient to digitalize the relationship with the healthcare facility. For example, to make the online checking. We can say that like for the airport, so making sure that he is giving the right information in terms of administrative paper. And then you can also book a meeting, an appointment with the provider, and then pay for the healthcare service. By the way, in terms of payment, Orange has a strong solution which is called Orange Money, which is widely used in Africa, but also now in Europe. And I will talk a bit more about that just after, I think. Yeah, here we are. So Orange Money has been created like, let's my notes, sorry. And it has been launched in 2008 in Ivory Coast first, and now it's 60 million customers in 17 countries. It's all about actually financial services, a way of making some payment using mobile application, a short text message, and it's working in this region because it's based on digital, it's secure, immediate, and cheap. So this is the magic recipe to make this happen. So you can make some payment and include some financial services. Okay. So, for example, in Ivory Coast, you can make some. You can actually buy some complementary insurance directly from Orange Money, and in Cameroon you can also pay some insurance. So there is some partner that are compliant or compatible with this way of payment, and this is a way, I think, to increase this this value. And the last topic I would like to share with you is just to illustrate that it's possible to connect actually multiple multiple facilities to a national information system. We've been part at Innovacom during the crisis. We've been part of the national screening platform for COVID testing. And actually, we have connected all laboratories and hospitals that were making some COVID testing. We have connected them to the national platform. So every day we are collecting something like 500,000 COVID tests. We centralize them. We make sure of the quality. And then we send this information to Santé Publique France, which is more or less the MOH. We send that to the Social Security for contact tracing. And they are also using this platform for day-to-day analytics and all the figures they are providing every day. So this was only to demonstrate that there is some solution, and I think at Orange we can really be of some help to make this challenge achieved and addressed correctly.
Thank you, Simon Chassin from Innovacom Orange Group. So I wanted to add that for under-medicalized areas, to spread health services, it's very important that the co-payment or no payment could be useful. And
sure.
In Ivory Coast especially, you are very implemented there. That's very important for under-medicalized area, to be sure that there is a guarantee of to produce and to provide some health services. That's very important. So, okay, thank you, Simon.
You're welcome.
I'm sure you will have some questions from the auditors. Franck Bodino. Nice to hear you, Frank.
Hello, everybody.
Okay, you've got 10 minutes also. Thank you.
Okay, I just request the control. Okay, so I'm very happy to be here with you today. Good morning, everybody. My name is Franck Bodino. I'm a medical doctor, and I created H4d in 2008. As a physician, I had the chance to work in different countries in Africa, in Asia, in Australia, in Canada, and identified the same problems that was how to access to health for population at large. And in 2006, I had the idea to combine new technology with this willing, and I invented the first connected medical office that is called the consult station. And in 2008, I created H4d. Yes, can you hear me?
Perfectly.
Okay. So today, H4d, it's a French company based in Paris, but we have developed the company in different countries, in France, in Italy, in Portugal, in Estonia, in the UK, and we just started in Middle East also. So apart from the technology, for us, telemedicine, it's global services. Means we need to have the best technology. So today in Europe, we are the only booth that is fully certified. And we are also FDA certified for North America. Means you can use this securely for both patient and physician. But also we need care coordination. So it means that we don't put the station in underserved areas or for our corporate clients, but we every time build medical programs. And the third pillar of our company, it's the H4d Academy. So during the 9 last years, we've been training physicians because we analyzed medical protocols, North American and European protocols, to know how to train a physician. Because as a physician, believe me, it's not the same thing to do a face-to-face consultation than to do a remote consultation. And it's not only how to guide the patient, how to use remotely devices, but it's also how to do a stomach examination, shoulder examination, etc., etc. So we do ongoing training for the physician. So behind the technology, we do primary care, occupational health, and preventive care. So what a consultation is? So today it's considered as a kind of microclinic. We implement the consultation on small villages, but also for corporate clients and also on hospitals. As you can see, you can use two modes of use. The first one is to do a self-made checkup. So the patient book an appointment, he go into the cabin and is guided by video tutorials. It takes between 10 to 20 minutes, and it's very useful to do preventive programs, but also to do triage in hospitals, for example. And the second mode of use, it's the teleconsultation. So at this point, you don't have video tutorials, but you're in live with a remote physician who is a GP or a specialist. So how does it work? As a patient, you're going to book an appointment through your mobile or using an internet website. You go into the cabin, you put your insurance card or your credit card, depending on the country where you live. You choose your language and you're connected live with a remote physician. The physician will ask you the classical question, how are you today, what the problem with you? We will ask you for all your medical story, and it will start the consultation. At the end, you will receive directly into the station the prescription, if it's needed, or on your personal website. So I wanted to show you a movie. I don't know if it works. I don't think so. So the service is provided 7 days per week, all during the year, in each country we work. In France, it's a mistake. We have almost 300 implementation, and we have almost 20,000 consultation every month. You have to understand that it's completely different that what we comparing on what you can do just by video conference, because this is clinical telemedicine. It means you don't have just an advice from your physician, but it's a complete consultation that is completely different. It takes between 12 to 15 minutes for the physician to do his consultation. So as you can see, we have different locations in France, and in different countries, we work with local authorities or national authorities on medical plans. I already told you that we can do primary care, acute illness, occupational health, etc., etc. In fact, we build every time the medical projects. This is the kind of diagnosis we did on the pods. And not only on the pods, but we develop full scope of solutions. We have this consult station that is considered as a microclinic, but we also have a small pod. And now we developed a home kit to be able to follow up the patients till home. Those were examples of kind of diagnoses we can do, because we work not only with GPs, but also with cardiologists, with dermatologists, with psychiatrists. And there are pictures on how it works. So you can see that everything is certified, especially during this COVID period. It's super useful because you don't have a waiting room. So you arrive as a patient, you take place on the station, and you can have your teleconsultation. We have a very high rate of use, both from patients and physicians. And physicians really appreciate that we train them to know how to use not only the technology, but how to improve their know-how on guiding the patients and do clinical examination remotely. So this technology is fully certified. It's very safe and accessible for patients and physicians. Thank you very much. And this is a few examples of big corporate clients or region we work with. Thank you very much.
Thank you, Frank. I know that unfortunately you've got a meeting just after, so we can't send you some questions from the auditor. So I can make a testimonial on your. We recently, with my team, we made an assessment of the use in an under-medicalized area in France. And the result was very interesting. 30% of people told us that because of the use of this clinical microclinic of H4d, 30% decide not to go to the emergency services, healthcare services. So it was a really big success, and more, months after months, people were involved to get an access in your cabin. It was a big success for this under-medicalized region in France. So thank you very much, Frank. One very simple question. What is the main difference between H4d and your main competitors all over the world?
The clinical aspect and the medical training, I think. First of all, because usually patients use just a video conference. So as a physician, I don't know how you can just treat simple throat or a chest pain or a ear pain just using a video conference. You need medical tools. You need to be trained as a physician. So this is the main difference. And the third one, it's that we don't just implement the technology. Every time we build a medical program with local partners, clinic partners, hospitals, and authorities. This is super important because we can coordinate care also.
Then, thank you, it's very clear. May I give you information for people from international areas, that in France we've got, as you know, a good level of expertise for medical services, social protection and so on. So when you create something in France, like innovation in healthcare services, you've got a lot of expectations, of constraints for technical, medical constraints, security, confidentiality constraints. So when you go abroad, when you go to export your solutions, the clients could be sure that you've got a high level of expectation, very high level of expectations you have in front of us. On the H4d, it's a very good example, like other solutions, of course. And we've got our champion Orange, you know, especially that you can't make confidentiality be sure for people that you are using French solutions. So thank you, Frank. Bye-bye. We will send you some questions from people connected and here in Dubai. So Robin, can you some word about TLM 360 in French, 3060 in English? Push on the little button? No? Okay. Can you push on the little button there, please? Thank you. Go to the picture of Robin Ohanessian.
Okay, thank you, Frank. Thank you, everyone, for this meeting. So I'm Dr. Robin Ohanessian. I'm a medical doctor specialized in public health and CEO and co-founder of Telemedicine 360. Yes, so the title of our presentation today was about mostly supporting governments in promoting sustainable telehealth, especially in this frame of the Expo 2020 and international and global presentations. So our specialty is mostly on telehealth and telemedicine, and as you know, and it was presented by our colleague Frank just before, telehealth is a remote medical practice which has been developed since many years. It's not new, however, since the COVID pandemic has been widely accepted and widely promoted and used in all over the world, in Europe, Africa, and Middle East as well. However, for telehealth to grow and be sustainable, it requires many infrastructure settings, such as legal, technical, and financial infrastructure. And despite what we have seen in terms of growth of telehealth during these past 2 years, all around the world, what we know as well is that without the right infrastructure and environment, this cannot grow further in the whole spectrum of telehealth, and not just only video consultation, but as a more widely spectrum of medical activity. So many countries actually initiated temporary telehealth rules and standards since 2020 in many countries of the world. However, most of them were temporary in nature and not completely designed to be for all the time. Such countries, for example, who did not allow telemedicine before the pandemic, did temporary regulations to allow it during the pandemic, but now it has to grow further. Such countries, for example, are Brazil or South Korea, which before the pandemic did not allow telemedicine. They changed it, but now what's next? So this needs to be broadened and expanded to actually support the long-term growth of telehealth, and also allow new type of activities, new types of projects, without having restrictive regulations. Why? Because every day we have new innovations, we have new startups and companies developing new technologies, and we should not develop regulation and standards which are too restrictive to allow those new
C'est bon. Eh bien, voilà. Alors, Simon, bon, on va 2-3 minutes, hein, on va terminer. Désolé pour cette interruption d'image et de son surtout. I'm sorry about that. Okay, I have to switch in English. Sorry. I was a little bit disturbed. So, Simon, 3 minutes to close your presentation, please, because of this.
Robin.
No
problem.
Sorry.
We're all together today. So I was saying that actually France is a global leader in telehealth. Why? Because it's been legal practice since 2009, and we're one of the country with the oldest regulations on telehealth, which allowed the country to grow and go more and more complex with time. Just as an example, in 2020, there was 19 million video teleconsultation which were reimbursed and paid by the National Public Health Insurance. So this is publicly funded, and there were many more that were actually also paid directly by the patient. And so we have an advanced expertise to share with the world, and we're the proof here in this session with many companies with 10 years experience, more than 100 startup company, and more than 500 millions of public investment since this 10-year time. So at Telemedicine 360, what we do is to support public and private organizations to develop quality and sustainable telehealth since 2015. We have helped the growth of telehealth around the world in Europe, Africa, Asia, and here in the Middle East. And what we do is that we start from national strategy all the way to valorization and demonstrating the added value of telehealth activities with 3 services: Telemed, Start, Audit, and Eval. So what we wanted to show is 3 very quick international case studies of the work we have been doing in the Kingdom of Saudi Arabia, Republic of Fiji, and Senegal. So we've been very proud to work on Saudi Arabia national strategy and regulations for telehealth, all the way to the national telehealth guidelines, which have been published very recently. The Republic of Fiji, where we helped the Ministry of Health in developing telemedicine policy, guidelines, and national group. And as well in Senegal, where we worked on the first telehealth diabetic retinopathy screening, also with the Ministry of Health, and supported and funded by the UN. So as a last point, we also contribute to science and digital health research, because we think it's very important to combine the innovation of the technology and as well the science and the medical to support and to back it. And we actually published one of the most cited research on telehealth and COVID, with more than 600 citations so far. So let's choose France, and let's expand telehealth together. Thank you.
Thank you very much, Robin. So in France, we've got technology, solutions, services, and expertise is a high level also. Okay. So, Alain, the first time I met Alain, I used your technology. I was very impressed. Can you describe it very quickly? You've got 10 minutes, so we will ask
just a test
question after.
Thank you. So I'm Alain, the CEO of Aquantik. Aquantik is a company that I have created with Fabien Niel, who is my great co-founder. So I want to tell just something about him. Anyway, Aquantik turns any camera, and especially any smartphone, into a medical device. So the idea is you take your smartphone, you look at your smartphone for 20 seconds, and we measure your vitals, such as the heart rate, your respiratory rate, and soon your SpO2, your blood pressure, and other vitals. So this is not magic. So if you may, I can perhaps explain why it's not magic. So I guess you know what is now an oximeter. So an oximeter, you put the oximeter on your finger, and it emits a light. So we are not an oximeter, but it's just the idea. And so the oximeter just measures the absorption of the light by the blood circulating on your finger. And when your heart beats, you have more volume of blood in your finger, so more absorption, and so the oximeter sees a spike, and so it can deduce your heart rate. We do exactly the same, but with the ambient light. So we measure the absorption of the ambient light by the blood circulating in your face. So it's just for an explanation. So it's a great technology, but for what? So obviously for home care, like prevention, like remote consultation, and also for remote patient monitoring. So this example of a remote patient monitoring is particularly important. So let me precise with examples. I guess you have about 2 billion people in the world suffering from chronic diseases. So it's the first cause of death in the world. Remote patient monitoring is a key for improving that. So it has been demonstrated that it has been demonstrated that remote patient monitoring improve the rehospitalization. So it decreases the rehospitalization, it improves the life expectancy, it's also improve the wellness of the patient. So what it's also called RPM is really important. However, it's limited by design. It means that for checking the patient health remotely, you need hardware, medical devices. So it means that the model is limited by design, so the model is not scalable. So that's what we change. Practically, we sell an API. So this API, an API is a piece of software that anyone, so any e-health solution provider can integrate into their product. So it means that anyone can enrich their solution with remote vital monitoring. And it's especially important for under-medicalized countries where when I talked about RPM, yes, but so it's difficult, but it's impossible in such countries. So it makes this possible. To success, so we need money, that's why we are raising funds, but also we need very good partners, great partners all over the world. So that's sorry for this.
That's okay.
But we need partners. So we already have partners, and just as an example, the next year we have planned to work with 16 hospitals in France, but also in several countries in Africa. So the last point is important because, so why? First, because such a technology should work with everyone and with every skin color. So that's why we have already tested the solution with more than 1,000 people in Congo, RDC, and we continue. So this is the first reason. And the second reason is when we say that we want to help so under-medicalized countries, we need to work with them and we need to be there from the beginning. So that's what we do. Thank you.
So it's very clear. I've got one question.
Okay.
Where are you located?
In Paris, France, at Paris Santé Campus.
That's a wonderful transition. Okay. Yeah, Paris Santé Campus. Professor Antoine Tenière, you are with us?
Absolutely, Frank. Hi.
Hi, Antoine. Okay, so you've got Aquantik and Alhambra in your site. What is exactly Paris Santé Campus? It's a very new and a huge innovation in France. So can you describe Paris Santé Campus in a few words?
Absolutely. Thank you very much, Frank, for this great invitation. And I'm really happy to be sharing some of the latest advances in France involvement to push forward the digital transformation of healthcare. So Alain is part of our community, but Frank as well, Frank Bodino, who has presented H4d. And the idea of Paris Santé Campus is to create a unique center dedicated to digital health, based on the concept that gathering expertise through entrepreneurs, through researchers, through caregivers, through institutions is one of the key in accelerating progress in digital health. And so Paris Santé Campus just opened at the end of 2021 and is designed to welcome more than 1,000 people dedicated to digital health and accelerate healthcare transformation in France by federating all the key players in the national territory and have them work internationally, of course, as part of important mission in health for France. So let me just see, yes. So the idea of Paris Santé Campus has been promoted by the French President Emmanuel Macron, and the program has been announced at the end of 2020. Basically, the program was pre-existing the COVID-19 crisis, but everyone in the world, and especially in France, could see how digital health, through the example that have been presented today, for example, have provided solutions to this pandemic crisis. And of course, the COVID-19 crisis made it more and more urgent to push forward this kind of initiative. And 1 year after, we were able to open the first emblematic site in the heart of Paris to welcome all the expertise from research, from care system, from industrial partners, from entrepreneurs, and from French institutions to gather in one site and work together on promoting digital health. And so basically, 4 main objectives that Paris Santé Campus will address. One large objective on data in healthcare. Of course, when you think of digital health, promoting data collection, data storage, data analysis, data protection is absolutely essential, and it's the fuel to promote and advance digital transformation of healthcare. So this is our first objective. The second one is to be able to create tomorrow's talents and identify the key skills that will be necessary to advance digital health and create innovative and reference training for France and to a larger extent for international collaboration for digital health. The third main objective is value creation, and I think you had a great examples through the different presentations today, how the exceptional French startup tissue or ecosystem is moving fast forward and creating value through digital health. And the last objective, of course, is to make sure that digital transformation of healthcare really serves improvement in a patient-centered conception of health system. And so in line with this main objective, a number of tools are available today. 5 public players that are really key in France for research, for training, and for healthcare, and especially digital health, are gathering together to promote Paris Santé Campus, to support 4 research institutes located within the center. And at its final stage, the goal is to welcome more than 100 companies in a center designed specifically for healthcare and digital transformation. That is 70,000 square meter large, that is currently under renovation with a large budget where public funding is partially invested to promote digital transformation of healthcare. Among the key players that I mentioned, for those who know the French ecosystem, INSERM is the National Institute for Health Research. INRIA is the National Institute for Digital Research. Université PSL is one of the key representatives for healthcare training excellence, in France. And the Health Data Hub is a structure that is in charge of collecting national data connected to the Caisse nationale d'assurance maladie. France has one of the largest data sets in healthcare that is organized through a public structure that is connected to the Health Data Hub. And the Agence Numérique de Santé is also in charge of promoting healthcare transformation. And through these 5 public key players in France, the relevant state department or ministries involved are depicted on this slide. Research, higher education, healthcare, and economy are heavily involved in the supporting Paris Santé Campus. Basically, among the 4 research institutes, researchers gather one of the best expertise in the world around digital health. The first institute is called Prairie. Prairie is dedicated to AI in health and understanding how algorithm can improve the healthcare system. The second institute is working on quantitative biology and digital modelization, so, for example, digital twins applied to a biologic system. The third institute is dedicated to imaging, that is under strong evolution with data. And the last one, which is very important, is dedicated to understand all the impact of digital transformation in sociological questions, in economic questions, and in philosophical questions for new modern society. So these institutes will collaborate with a large set of startups, small companies, and large industrial groups that are gathering Paris Santé Campus and promoting a large gathering of expertise on site. And of course, you've understood through what I've explained that one of the main concepts is to be able to assemble expertise in data, innovation, research, care, education, and companies through this exceptional initiative. Of course, the idea is not only to gather and to assemble French expertise, but also to have a large network of collaboration and very active international outreach. And in line with this, I'm really happy to be presenting you this program. And one of the first set of expansion is, of course, the European Union, but to a larger extent through academic and industrial collaboration, to also create a worldwide network dedicated to promote digital health. So the first center has opened, as I said, at late 2021. So you have a picture of this first center, and we're happy to be welcoming all of you who would like to visit when in Paris to see how this ecosystem is building and is producing and is creating synergistic views of digital health and digital transformation. So this is an example of the setting of the building, and you can see how academic research labs, how caregivers, how companies are fully intricated, and a large atrium in the center of the building is really helpful for us to create this campus life that we are animating to promote meetings. And Frank can actually testify that meeting researchers and other people that you usually don't meet is absolutely essential to advance innovation. Of course, there's a unique value proposition for industrial that would like to join Paris Santé Campus. And so we have entry points for startups, as I said, but also for larger companies and to big French groups that would like to help and think strategic axis of digital transformation with the French institutions. And so we're in the process of gathering this large players and starting our first programs. And I think, yes, I have a few views of the building that you can see through this video, and a number of testimony that we have gathered through students, through researchers, through startup companies, through larger groups, and through institutions that are actually explaining why they would like to join Paris Santé Campus and what value it can bring for their business, for their research, for their training programs, etc. And I think in line with this, I am done with my presentation. Of course, Paris Santé Campus is a great community that put in value diversity and investment in digital health. So we're happy to be welcoming new players that will add living ideas to this community. And I would like to thank you for your attention.
Thank you very much, Antoine. It was very clear, interesting, beautiful picture and videos also. Okay, thank you very much. You can send by chat some questions. We've got one, and Noémie, our friend based in France, actually located in France. We've got some questions, and I will share with you some questions and distribute some questions. Mehdi, are you always with us, Mehdi?
Yeah.
Okay. Mehdi, can you tell us who are the stakeholders, the shareholders of your company? Because it's a very specific approach in France, a new one. Who is the main stakeholder or the new stakeholder?
So we have something like really singular in our story, where APHP, which is Assistance Publique des Hôpitaux de Paris, which is actually the largest hospital group in Europe, who is part of the company, which is something like it happened for the first time with us. And we value this so much, first because the step we are now to having been developing in our device in the condition of costs that we were targeting, it was really possible because of the medical community of APHP. And beside, APHP is also for us a great way to deploy and to validate the usage. APHP is both something like 10,000 medical doctors, 20,000 MDs. It is strongly connected to universities, so that the students will be able to also be trained with this kind of devices that we brought to, let's say, a price of a stethoscope. And also APHP is a strong network of homologous hospital group at the level of Europe, of the level of other places in the world, West Africa, South America, and also Southeast Asia. So that for us is a tremendous chance to develop in the right condition this technology to really to be the more helpful for the medical doctors, the paramedics, and to be obviously the more best way to take care of the patients. On the other side, from more academic side, we're doing obviously a lot of R&D, and we have 5 top-level European labs that will be working on those like 3 years, based in Belgium, based in Netherlands, in Switzerland, in France. So that we have I think the right partners to develop our technology and to deploy to the market.
That's why I wanted to highlight this point, because if you want to buy some solutions from EcoPen, you have a powerful organization behind EcoPen. It's more than 100 people are working. It's international development also with APHP. So it's just EcoPen. It's all the French hospitals from the Ile-de-France in France that is with you to buy and to implement EcoPen. That's very, very important. That's the big power behind EcoPen. Okay.
Yeah. Exactly.
So I'm here for make promotion of super system in France also, you know. Okay, thank you, Mehdi. I've got another question. Don't quit the discussion. Simon. Yeah. Okay. I'm a director of hospital, of an hospital. for instance, in Dubai or don't know, don't bother. What are the added value you can propose to me? What kind of services? Because I need to exchange information, data with medicines, physicians around my hospital. What kind of services do you propose?
Well, I think one of the most important value we can provide to any hospitals is to allow the healthcare professional to save time. You know that data integration is a way to avoid some multiple entry into the information system. Very oftenly, when an hospital gets digitalized for the first time, it's bringing more task for the healthcare professional, which is a little bit frustrating because IT or digital has to be something that allow more productivity or more efficiency. So that's a bit frustrating for them. So this is where we come, and we provide some additional solution, intermediate solution that will help the healthcare professional to save time and be more more digital fan, I would say.
Okay. Do you know how many people in Ivory Coast or Senegal, I don't, both if you want, are using daily your solution to get an access to something, especially for healthcare services?
That's a good question. I think this is quite a lot because Orange is operating as a mobile operator, telecom operator over there, and yeah, I don't have this figure in my mind, but
okay. I remember that in Africa last year more than 600 million people are getting to the new mobile. So it's a huge interest to get an access to healthcare. That's maybe the more useful activities with the mobile at the end. Okay, thank you. Sorry, I've got other questions. Okay, and I've got to you from Robin one question right now. Noemi, you've got a question. You tell the question from the auditors.
Yes. Hello.
It's for Robin, I think, this question.
For now, there is one question from the audience on the live chat. They were wondering if the telemonitoring of patients will be reimbursed in the United Arab Emirates, and if yes, what are the challenges in diabetes?
It's for Robin.
Okay.
Yes.
Thank you, Noemi. Thank you, Noemi.
Thank you.
Yes, thank you for the questions. So the landscape in the UAE for telehealth reimbursement is actually quite interesting because it is firstly mostly driven by health insurance and less by public reimbursement. However, there are different things to consider. Firstly, in your question is what do we consider as remote monitoring? Because remote monitoring can be done through video consultation, periodically done. It can be done automatically with a hardware device. It can be done with questionnaire, what we understand as remote patient monitoring, with or without devices. And then when we take into account remote patient monitoring for diabetes, the most common acceptance is the glucose monitoring, continuous monitoring. I don't know exactly what will be the future in UAE for this reimbursement, but I hope that it will come to light so that the patient in the country and more globally as well in other countries of the Middle East can access to these services, which has proven to be effective in reducing complications.
I think that more and more in this region in particular, the TPA, third-party administration operators, could be very involved in how to get, in fact, the healthcare services with e-health, especially in Saudi Arabia. Alain Abra, Aquantik. How many competitors have you got in the world? Do you know?
How many exactly? I'm not sure, but I can say that we have 1, 2, 3, 4 really important competitors I don't say that we don't have others, but that's the one we take care about. Yeah.
And why you will win? What are the differences? What are your skills?
So the first thing is we are very confident in our precision. The accuracy of our measures are very good, and that's also why we are tested in France and in other countries, and especially so in some African countries, because it must work with all skin colors, what I said before, and that's why also I'm so confident.
Okay. Maybe you can mention that to be placed, to be in the Paris Santé Campus, it's also a skill for you, maybe? An advantage?
Yeah, it's more than an advantage. So yes, so since we are there, we really understand that. So it's not just about network; it's about really working together. If you have a question, if you want to discuss with someone who understands, so the regulations or how to deploy somewhere in France, you can discuss over there. So yes, there are really good partners, but they are not the only partners we have. That's why we need to work with hospitals and physicians. So obviously we need to work with a lot of physicians. That's what we do, and some more other partners I could talk about later.
Okay. Antoine, there is a lot of people from Dubai that are knocking at our door there. They want to go to Paris because they saw your presentation. They are very impressed. And what kind of possibilities you can propose to, for instance, a lot of Dubai director of hospitals, insurance companies wants to show in the same place what is the better expertise, better solution in France. What is possible? Is it possible to visit you to have some that kind of services?
Of course, Frank. Thank you very much for your interest in Paris Santé Campus. I'm happy to organize a group visit or an official visit, depending on the level of representation that UAE wants to provide at Paris Santé Campus. And I think it's a great opportunity for us not only to present Paris Santé Campus, but more importantly to see with our UAE friends how we can promote joint collaboration or joint expertise on digital health. So I will pass my contact information, and I'm happy to coordinate this through the French Healthcare Association, of course.
Okay, people are outside, knocking at the door. They ask me, is it free of charge? They have to pay to go to France. Of course, there's a ticket fly, but they have to pay to the entrance of Paris Santé Campus for this organization of presentation and so on?
No, we of course we're happy to invite people to visit Paris Santé Campus for free. There's no need to pay at the entrance.
It's okay. They will come. They will come. Thank you very much. Alain, one more question. Who are exactly your clients? Because in front of us, you've got a lot of people, maybe 10,000 people told me, Noemi. You want to sell something, we understood, but...
Yeah, okay, so our clients are the all e-health solution providers, so especially the one who are doing remote patient monitoring, we talked about that, but also remote consultations. Some others are doing triage in emergencies. So this is another application. And practically we sell the API so that can integrate this in their product. So actually, if they want to have remote measurement, they just take this piece of software, put in their product, and seamlessly in 1 hour it's done. Okay,
and to be concrete, at the other door, the people are interested. They ask me, is it expensive, your solution? The IPA is expensive?
So it's actually it. So it's not like start like that,
yeah.
but we adapt our model to the model of our clients. So let me give you an example. So obviously, if you discuss with teleconsultation platform, often their model is a payment per physician. So we adapt. And if it's for remote patient monitoring, often it's per patient, so we adapt as well. So, and so they pay when it's used. So actually, it should not be expensive at all.
Okay, so I've got a question because, as you know, in every continent, people are very aware about data privacy. And more continents like China, Russia, and so on, the United States, of course, so are protecting their databases, especially for healthcare databases. So if I buy your solution, and for instance, in China, my data will be sent to French databases, French cloud or something?
So we cannot think like that, you're right. We need to adapt to the country, to the culture. So obviously, if we sell to China and they want to have the database over there, the database will be over there. If they want the process to be over there, because actually it's a SaaS API, the process will be done in China as well. So we need to adapt. In France, we need to have servers in France. In the US, we need to have the server over there as well.
Mehdi, you are there?
Yeah, I'm there.
Still there. Same question for you, Mehdi. If I'm a Chinese insurance company, and I want to propose it to my reimbursement scheme. So if I buy your solution for my hospitals or my TPA and so on, information will be sent to a PHP databases?
So actually, what we did is we have a cloud platform fully standardized towards the RGPD, the GDPR, and we will be connecting to any kind of healthcare facilities, and we are actually interoperable with the information system that wants to get the data into their own systems. So obviously, since the very singular relationship that we have with APHP, it will be the first use case for us, but we can connect to pretty much any kind of healthcare facilities. We took care for having a streamlined pipeline for the data that can be anonymized, and also in the right, let's say that international standards like FHIR, FHIR, those kind of things, so that we could really be connected to any kind of healthcare facilities. Can be French or international, for instance, Chinese.
Okay. Thank you, Mehdi. So in France, you are based in Paris Santé Campus. It's a good opportunity for you. You told me at lunch you were very happy about that. Remember, and abroad, when you go abroad, we are lucky because we can work with Orange, our champion for security communication, and we're very happy to French healthcare to have you. To have Orange in Vacom. So what is your way of thinking about how you can carry a lot of startup, very successful and potential successful startup, to carry them and to build something like a frame of security connectivity frame? What is your strategy on the my question is, I'm in South Africa, South America, and so on. I want to use some this kind of very clever solutions, very interesting solutions from France, but I need to have something like an integrator, not only integrator, technical integrator. Do you play this game?
Yeah, for sure, for sure. I think there's two sides around this question. There is of course, like I mentioned before, Orange is operating worldwide, and we are in 26 countries. So there is this I would say sales channel that is good, that could be delivered quite easily. But there is also another side, and I've heard about FHIR or interoperability. We could also play a role in that process, because there is a lot of very good ideas. Aquantik is one of them. Very smart people that are creating some very interesting solution, but very often they are in trouble to get integrated with hospital information system, because it's to be honest, it's very tricky. And this is where we can also play a role with the cloud solution that could be also delivered around the world, and help them, support them in that process. I think there is really some value over there. You cannot be focusing on the specialty you are delivering. I think what Aquantik mentioned is very innovative. So they cannot be everywhere. So they need to focus on their business and rely maybe on Innovacon or Orange for some specific issue like integration, which is quite difficult, and you need to be a specialist for really having something interesting to deliver.
Thank you, Simon. In the world, what are the main regions you are interested in right now?
Okay, so at Innovacom, it's quite easy. We have a good presence in Canada. We won a regional project. So we are delivering our platform to every hospital in Quebec, so which is almost half of the Canada, for people who don't know. We are also serving some hospitals in the UK, NHS Trust, but also in Europe, French-speaking Europe, Switzerland, Belgium. We have a very interesting project in Finland, very innovative hospital, new built, and they are using actually one of our solutions every day to take vitals, and this is something interesting because they are really mobile oriented. This is not the case in Europe, where the mobile is not widely used inside the hospital, but over there, if you are not mobile, you don't have any place to play. And we are really exploring the Middle East region, and it seems that we could have a lot of attraction over there. So let's see what's happened next time.
Okay, I think that this region is very interesting. It's
definitely.
I'm very impressed by the money put into the system here, not only the health system, but it's incredible, really, really. So we've got to organize ourselves in France to go to be more present in this part of the world, I think.
And they really consider digital as this is key for them. They really take that as a...
But competitors are very strong, very American ones, and especially I thought the booth of American John Hopkins Hospital, a friend of mine, is in charge of international. We can make some partnership for Professor Antoine Celia, but also Mayo Clinic and so on. They are very present here. Robin, a few words. What is for you, in your experience, the most interesting country to observe how they get from low level of e-health to a good level of e-health?
So actually, we could we could see that during the past 2 years. India is a good example. Before the pandemic, there was a few initiatives on telemedicine. However, they did a huge improvement where they built a national public telemedicine platform where everyone in the country can access that platform, and supported by national trainings and standard of good practices. So India was a very good success, and in France it was not a low level, but we saw a huge increase during this past 2 years, and maybe the two regions that increased a lot comparatively could be Southeast Asia, mostly mobile driven actually, and the Middle East, where there was a huge increase. And just to give a few last comment on the previous question, which actually triggered some ideas. We have actually in France a national pilot program for remote patient monitoring of diabetes, funded by the government since few years. So if UAE nationals or hospital director, company are interested to support this funding, we have the experience and we can share it as well.
Do you think they have got diabetes people here? I don't know. I'm not sure. I'm joking. A lot of course. Mehdi. Yeah. I want to buy a pen. When it will be possible, and is it expensive? I'm sorry about this very trivial question.
No, this is one of the key aspects that we have been working on for the last few years. It will be around, let's say, 10 times cheaper than what you get on the market, usually on average, for a like quality. And this is something like one of the key advantages of Ecopen. And obviously, if here in the audience people want to know more about our technical characteristics and how we'll get to this price, we're open to discussion. We're expecting the CE mark in the next few months, hopefully in the markets in the next few months.
Okay, thank you. That's very clear. 10 times less expensive, you told us.
Around 10 times less expensive than the average on the market, yeah.
And for the services, it's 80% of the scope you can use for the most important device, you told me.
Yeah, it's a screening tool that enables you, to do orientation diagnosis in a large amount of diseases. And let's say that this is by default, and on the top of that, we put AI systems where we can enhance some interpretation abilities for the end user, for the medical doctors or the paramedics. Yeah, definitely.
Okay, typically, what kind of client you want to address in the beginning of September, for instance? It's emergency services?
Yeah, let's say that if we go to our market access strategy, I won't go into detail, but let's say that basically hospitals are very important, healthcare facilities in general are very important targets for us. And in this, all the practitioners that make, let's say, a general use of medicine, like emergencies, anesthesiologists, people working in resuscitation rooms, pediatricians, and guys in internal medicine are really into our very first scope.
Okay, we've got 5 minutes to the end. I jot some words about the French Care Association on my workshop because I'm the pilot. So it's very important for us in France that to spread our wings and to sell our solutions, our services. It's also a responsibility approach, and we've got to have a sustainable approach and to promote also the increase the level of skills for physicians and nurses and so on in the countries. So that's I think a big difference between our country and the other countries. That we want to spread our wings, of course, but we know that with our experience, it's not only my opinion, is that it could be sustainable because we want also to transfer, to give some skills and to transfer our skills to people we work with. That's very important. That's I think a very big difference between the French approach and the other. Also, in our group, we are working on solution services with performance, but also how to link to the reimbursement schemes, policy of reimbursement in the country, and also non-profit organizations like Mutuelle, and we've got here in Dubai Yannick Luca from Fédération Nationale de Mutualité Française, and that's in our group in French healthcare. We make the link between the solutions, services, ideas, innovation, and also how to implement with ethic, transfer of competence, and how to get into the scheme reimbursement. So that's very important. So, Antoine, I will ask you to give maybe two or three words. It's freestyle as you want. Antoine, what 3 words you want to say to all people, and the replay will be very interesting for them?
Well, basically, I think what summarizes the exchanges today, I would say excellence, innovation, and success. And I hope a lot of collaboration will come out of these discussion. And again, Paris Santé Campus is very much open to welcome anyone who would like to visit and collaborate with the French healthcare system.
Okay, Dubai people bought their tickets, they told me. Okay, thank you, thank you, Antoine. It was very, very clear.
Do we have time for one last question? Sorry.
Oh, another question. Okay, let's go. Noemi.
Yes, there is a question in the live chat. So the question is, how did the pandemic help e-health in general and your solution specifically to become more part of the mainstream care delivery? And what will be the which will be the enablers to sustain this move?
Allez, Simon. Okay. Simon, short answer, please.
Very good question. Very big question as well. I'm not sure to be able to answer that in 1 minute, but for sure, e-health has been driven by this pandemic because we understood when I say we, this is the healthcare organization in general that we've been late in this domain against other industries, and it has been like a real discovery for them. So I think now everyone knows, and they are investing a lot, and they really think that e-health solution can be really efficient and helpful for everyday care, and I think this will be sustainable in time, in the time. So I think for sure.
Okay, Robin.
Maybe I can add just one point for us, but I think it's the case for Aquantik and all the guys here. For sure, remote access to healthcare information are now really critical. And as for us, obviously, we can also share remotely the data. I think Aquantik can, and I think this is really the next move forwards for all the industry of med technology and for the healthcare usages. And besides, one point maybe more specific to Ecoburn is that there were a lot of publications those last few months, and especially one in the Lancet, where a panel of experts drew what should look like a healthcare facility, a primary healthcare facility especially. And there were this opinion that among several tools, critical tools, ultrasound handheld device should be one of them in a post-COVID world. So yeah, broadly, definitely COVID accelerated the move towards everything that we can do remotely.
Is that your last words, Mehdi, or do you want to say something more? Okay, it was your last words. Robin, your last words.
So I will go on the second part of the question. For me, would be a legal framework. Today, majority of the countries in the world lack a proper healthcare framework, and especially for digital health or telehealth framework. So we don't know who has the right to do what and with which consequences, and that can be a big problem. The second one is technical infrastructure, how to identify a patient digitally, how to identify a hospital and a doctor. The data sharing was already said, and I would add as well continuous medical and scientific research, because it's not because something is innovative in the medical field that it actually has a demonstrated scientific impact. So we need to continue this as well. Thank you.
Thank you, Robin. Alain?
Thank you.
So my last word. Okay. Actually, what I would say is, so our field is pretty difficult, you know. So we need to certify, we need to work together, and we need to work together again. I mean, if I would say one thing is we should try to work with startups, with big companies, to share data, to make new projects and try in the fields together. It's something that usually is not done, and I would say that we should start a little bit more.
Okay, I've got 4 last words. 2, choose friends, and thank you. Bye-bye.
Thank you.